Y'all, yesterday I got some fillings in my teeth, and let me show y'all how you can avoid having to get fillings. Story time, I had my dentist appointment 45 days ago, and they wanted me to come back 45 days later just to check on my gum health. But the last time I went, my gums were like bleeding a lot, and I had a lot of cavities, and they told me to start flossing more. Now, I already had a water pick. I had just stopped using it so much because it was a lot to keep on refilling. But soon after the appointment, I did go to Target and I picked up these Grin flossers, and let me tell you how much they have helped me. By the way, this video is not sponsored. I'm just spreading awareness. But she told me to start flossing more, and that's what I did for the next 45 days. And I brushed my teeth twice a day too. Now, as we all know, well, I'm hoping we all know because I was not that educated on this, but apparently when you floss, you're digging like the gunk, like the tartar and whatnot out of your teeth that, you know, inflames your gums, because inflamed gums and cavities come from bacteria under your gums. And when I started flossing, I was able to get that bacteria out so that my gums could heal. So yesterday I went to the dentist, got my cleaning, and there wasn't as much blood. And she told me that the flossing definitely did help. So I did not know that flossing was a pivotal part of an oral hygiene routine, because I just thought that my teeth were always fine and I didn't need to do it. Now, don't look at me the way you're probably looking at the camera talking about, girl, how did you not know that? I did not know that. I never thought that flossing was a necessity. I thought it was something that you can just add on to your routine, like a scrub. You don't need a scrub, but it's something that you can add on to your routine for that extra layer of softness. You get what I'm saying? On top of flossing, I do use the Act mouth rinse, because you're not supposed to use Listerine, just because Listerine contains alcohol and that can really like mess with your gum health. I also use Sensodyne because my gums are sensitive, and that's been working for me too. I also do use a tongue scraper, and what else do I use? There's something else that I use. I forget the name. Oil pulling. Occasionally I do oil pull. That's the name of it. I just can't get past that oily texture in my mouth. Like, I want to do it every day, but it's hard for me to do it just because of that weird taste and texture. I use the one from Guru Nanda. But yeah, don't be like me and not floss, because you will have a hard time at the dentist. She did explain to me that it's just a continuous cycle of unhealthy gums if you don't floss. Basically, you're going back to the dentist, you're getting your cleaning, but then if you're not doing the work at home, your gums are just gonna keep being in terrible shape. And she told me that my gums were a lot less inflamed once I started flossing. So yeah, if you're not flossing, please do start, because as you can see, in just 45 days I was able to improve my overall gum health. Now, update about the dentist. If you've never got a filling before, it's really not that painful. Like, they just numb you. They stick a needle into your cheek, and I was numb for a couple of hours actually, like until I came home. Like, if you guys have seen my Instagram post, I was looking like this because I literally could not talk. I couldn't eat or drink without the food just falling out of my mouth. So yeah, definitely make sure you eat beforehand too, because they're gonna give you pain meds and your chest is gonna hurt if you have not eaten all day, and you cannot eat until that numbness is gone. I was numb all the way from my ear to my chin. Like, this part of my face was very, very numb. So that's one pointer if you're getting fillings anytime soon. But update on me, like, I'm still feeling a little bit of soreness just because the doctor decided not to do a root canal and just do the 3 fillings. And then I got a small filling on my front tooth where a cavity was forming. But yet, cavities just come from the bacteria buildup. So definitely do try to floss at least twice a day if you can, or at least after eating. That's one good part of self-care that people don't always talk about, that I want to start talking about, because it is so important. And so basically what they want to do next is my upper right, just because there are a bunch of cavities over here. And if you're wondering how I got so many cavities, it's because when I was a kid, I used to eat a lot of junk. Like, I did not always look the way that I do now. You know, when I was a kid, I was in like the worst shape ever, and now that I'm older, I'm dealing with a lot of what I did as a kid. not eating healthy to not getting enough exercise to my gum health. I just let my teeth rot. And I haven't like had any real like rotting teeth or anything like that, just a lot of cavities that could turn into root canals if you're not careful. So definitely keep up with your dentist visits every 6 months. Please do try to go to the dentist. Don't be like me and wait a long time. When I was in school, I did not have a lot of time to take care of myself, and now I'm dealing with that today. So self-care is not just body care, it's what's inside too. It's the stuff you're eating, the products you're using in those sensitive areas like your mouth. Like, definitely stay on top of that so you're not like me and have to pray that you don't have to get a root canal every time you go to the dentist. Story short, if you're gonna eat sweets and if you're gonna drink sweets, please brush your teeth twice a day. Your teeth don't have to be pearly white for them to be healthy. The healthiest teeth have a little yellow tint anyway. It's fine. Definitely floss every single day. I'm telling you, start today. If you don't floss, please, you will save yourself a lot of money too. My birthday is coming up soon, and that really did take a lot of my money just on teeth. So yeah, please do practice gum health. PSA. Bye.